So it is not an exaggeration to say that the next person who's going to say a few words is literally the leading voice for people in not just this state, not just New England, but in the entire United States of America, and I would even say the world, when it comes to mental health and addiction. And a couple years ago, he wrote a book, and the title of that book was called The Common Struggle. And as Senator Lesser just alluded to, the reason why that title resonated with so many people is because it is a common struggle. It affects so many people, not just anywhere based on where they live or who they are. It affects everybody. And it's so great to have somebody here today who has not only dedicated his public service career as a member of Congress to this cause, but also his private life to this, to trying to go around this country and get laws like this passed. And it's such a pleasure to welcome former Congressman and a true champion for this issue and every issue, Representative Patrick Kennedy.
Well, thank you so much, Sean. And I can remember going door to door with you several years ago when my brother Ted was running for state senate, and this was obviously a cause of his when he was here in the state legislature working with his colleagues on the Senate side. And Matt, thank you so much for your leadership on this. I am a product of the state legislature, not far north of here in Providence. The opportunity to serve in the state capitol left me in the same boat that all of you are left in. There were 100 of us for a little state like Rhode Island. So when it came to acknowledging everyone, we were never quite able to get to the front. But it was a wonderful experience, and blessed to have had it. And I also feel so grateful that I got a chance to be the sponsor of this Mental Health Parity and Addiction Equity Act. And you may ask yourself from looking at me, even though I look kind of young, how in the world, I know you kind of question that, how in the world could a congressman who's the youngest member of the United States House of Representatives at 28, from the smallest state in the country, Rhode Island, and in the minority party, when Newt Gingrich took over control of the House, put his name first on a bill that said no more than the brain is part of the body. I mean, we all know as state reps, when it comes to a popular bill, it's left to the leadership to put their names first. It's never for the newer members. They have to wait in line. It's a seniority system. So why was it that I got to be the champion? Basically, you're getting me today by default. And that means that no one else wanted to put their name first on a bill that had the words mental health and addiction in the title. I can't understand why that might be for anybody in Washington, D.C. wanting a future career in politics. I guess they would expect that the media here would ask a few questions like, have you ever had a mental illness or addiction yourself or in your family? And for a politician to try to go down that road, that's not a good thing. Because if you say yes, there's 35 more questions on how was the treatment, what medications are you on, and are you all right? I mean, nobody wants that tag. And fortunately for me, because I came from such a famous family, I had my anonymity broken when I was a state rep, and a guy that I had been to drug treatment with at 17 sold his story to the National Enquirer about being in drug treatment with me. And of course, I thought that meant the end of my political career. But the irony of all ironies is that it meant just the beginning of my career. Because I never would have had the life that I've had fighting for an issue that's so personal to me and my family had it not been for that rat who told my story without my permission to the National Enquirer. And in Rhode Island, the only thing that they hated worse than drug addicts were rats. So I managed to survive, especially in the Italian-American sections of Providence, who they certainly didn't like the fact that this guy ratted me out. So I just want to say today we are at a historic point in this struggle. This bill, the Mental Health Parity and Addiction Equity Act, is a modern-day medical civil rights bill for those with brain illness. It says that their illnesses ought to be treated equally as every other illness. That it ought to be cared for in the same way, given the same chronic care management, that the people who do care for people with these illnesses are reimbursed in the same way that any other caregiver or specialist would be reimbursed, such that there would be adequate networks of providers to take care of the great demand that's out there for those who are seeking care for depression, anxiety, for addiction. And so this legislation says, just like our federal legislation, we don't want any more separate and unequal treatment. We don't want to be told when we come into the hospital that your illness isn't the same and you have to go down the hall and drink from the colored water fountain. Because that is the imposition of how stigma has been placed upon these illnesses to such an extent that it exacerbates these illnesses by isolating and marginalizing those who suffer from these illnesses and keeping them from even seeking care in the first place. It's a mystery to me as to why insurance companies want to micromanage these illnesses so much when there's only less than 10% of the people who need help actually availing themselves of mental health and addiction. It's not like we're flooding the hospitals, and even though the addiction rates are so high, less than 10% of the people are getting treatment for it. So why is this such a historic point? It's not only that just 2 years ago, the Attorney General of New York entered into a consent decree with Cigna and Blue Cross about their failure to follow the parity law, and put that consent decree into effect, which then affected all of their national standards with respect to pre-authorization. But just a month ago, the Insurance Commissioner of Pennsylvania cited Aetna Insurance for gross violation of the federal mental health and the Pennsylvania state mental health. And they even cited the fact that Aetna violated the quantitative treatment limitations, which have to do with the co-pays, deductibles, premiums, lifetime caps. Those are the easiest things to determine whether an insurance company is making an effort to adhere to the law, which says they have to treat these illnesses the same in terms of their coverage. The more insidious and essential aspects of enforcing parity come with respect to the application of medical necessity determinations, which come in the form of pre-authorizations, concurrent reviews, retroactive reviews, and the like. And those need to be monitored because those are the things that insurance companies are now using to limit the care to those who need care for mental health and addiction. And just today, Kara, can you unlock that for me? Just today, literally half an hour ago, we got what I believe will be the equivalent of a Brown v. Board of Education for the cause of mental health parity and addiction equity. Just as of 15 minutes ago, we were informed about a landmark mental health ruling from the United States District Court that held that United Behavioral Health, UBH Optum, the country's largest managed care behavioral health care organization, illegally denied mental health and substance use coverage based on flawed medical necessity determinations.
Wow. Wow.
Major decision. And I'll tell you what it means to Connecticut. It means that it violates the Newtown law, which says that mental health care in this state ought to be aligned with the best in medical standards for the care that's given. Not based upon what the insurance industry cooks up as their criteria, but based upon independent, medically sound criteria. And that is a violation of the Newtown law, which says that that ought to be a necessity with respect to any insurance coverage in this state. So all I'm going to do this afternoon is join with my colleague, Congressman Jim Ramstad, my Republican colleague, and we are going to write a letter to the 100 top clients of United Healthcare in this country and to their CEOs, informing them that they currently have, as a vendor, a third-party administrator, United Behavioral Health, which is in gross violation of federal law. Because you know what? Under the ERISA laws, employers who utilize companies that are in violation of federal law have a fiduciary responsibility. In other words, they're liable too. So that this is not to be seen as just a law that's going to micromanage, even though that's what it does. Thank you very much, Sean and Matt. The disclosure requirements for how medical necessity criteria are applied to each and every decision that is made by insurance companies here in Connecticut when determining whether care is covered. But it also means that we're now going to tell these insurance companies that not only are they going to be held liable, but those that contract with them. So as you know, not far from here in Rhode Island, United Healthcare has the state contract for state employees, which, as all of us know, is the most lucrative contract any health insurer can get. So Congressman Ramstad and I, in addition to sending letters to the top 100, employers are going to write to those states that have United as a vendor and say, how can you be using public taxpayer dollars to subsidize insurance company profits when they are grossly in violation of Federal Civil Rights Act with respect to mental health and addiction? We're not going to allow that to happen. Now, finally, I'll tell you what it also means to Connecticut. I don't know if we have that board showing the disparities in care. So, here are all your neighboring states, okay? New York, Rhode Island, Massachusetts. And this is the Milliman Company. They're the independent analytics, guru of big business. And they evaluated 46 million payer claims data across the country. And they found, guess what? Connecticut is the worst state in the nation with respect to disparities in access to care for your state residents. And that is why I am so pleased to see so many state legislators standing up for your constituents who find it intolerable that the opportunity for outpatient and inpatient access to care is so dramatically higher in Connecticut than when compared with New York, Rhode Island, Massachusetts. 39% higher, greater disparity in access to care than you would receive for medical and surgical care. So this is an opportunity for you today to correct this injustice by passing this law. And I thank again Sean and Matt for authoring it and for the leadership in the both Republican and Democratic caucuses for getting behind it. And at the hearing, I'll be able to share more information about this United case. And the reason I say that it's such a profound case is that it finally documents in a meticulous way by this federal judge how United deliberately and flagrantly violated the federal law with respect to the coverage of those who had an illness of the brain as opposed to an illness of any other organ of the body. And how that demonstrates so patently why we need not only more state laws like the one that Sean and Matt have authored, but we need to have more state enforcement. And I'll conclude with this. Representative Ramsden and I are also writing letters to the 50 state insurance commissioners and the 50 state attorneys general, because the attorneys general have a responsibility to protect the state's residents against fraudulent contracts. And if a state is doing business here in Connecticut, it's doing business because you, the people of Connecticut, have given them the privilege of doing business in this state. And you shouldn't give them that privilege without them validating that at the very least they're following the laws and regulations that as lawmakers you have passed in order to protect your citizens. So that you can say in the future there's going to be no insurance carrier going to be doing business in this state that doesn't follow the law. That's not asking too much. But we obviously need a voice for mental health and addiction, and I appreciate everyone's voice here today. Thank you very much.
We're going to try to find a way to keep Patrick here every single day until we pass this bill. So I'm confident we're going to get it done if we keep this energy up. Thank you, Patrick, for being here.
If you could, as a leader on Parity, a leader on the national model for this next level of Parity legislation, can you tell me why it was so important for you to fly out to be here in person, to rally support, to raise the visibility of this? Why now? Why Connecticut? Why are you here?
We need to build momentum nationwide, because just like the civil rights movement, we all depend on each other. And the success here in Connecticut can lead to more success in other states. There's a critical mass that we need to build. It's much like a political campaign. It's not a partisan effort, but it's a campaign nonetheless. It's only partisan to trying to get people to get the coverage that they need, to stop this public health epidemic, and to enforce insurance company regulations that say that they cannot treat illnesses of the brain any differently than illnesses of any other part of the body. We find that the fight for mental health parity is really a proxy for a fight against the denial writ large, because we're not only talking about an insurance denial vis-a-vis pre-authorization, concurrent review, retroactive. We're talking about a much larger societal denial of these illnesses as real medical, biological illnesses. And when we stand up with this kind of parity law, we're not only saying we want to end discrimination, but we're making a proactive statement that we as a community reject the label that these illnesses are not real illnesses.
What would you say to Governor Lamont, Connecticut Governor Lamont, other legislators who say, we already have parity on the books, we're good, why do we need to hold the hand of the insurance companies? Why do we need this law? Why do we need HB 7125?
We need HB 7125 because it expands the definition of those illnesses covered to include substance use disorders and to also make very specific requirements for disclosure of medical management practices that currently don't seem to be adequate to ensuring that the residents of Connecticut get access to mental health and addiction services in the same way that they could medical and surgical care. We have seen through analyses of medical payers' claim data that there are huge disparities that persist. And so new efforts need to be made to address those disparities. And I think this law cannot just be passed and we think we can go home. It needs to be passed, and then we need to apply it and we need to enforce it. We need to get the insurance commissioner on board, the attorney general, and of course we need to get the governor. The governor Lamont has stood with me on many occasions, committed to this cause. He did so throughout the campaign in a very proactive way. We're already going to meet shortly after this hearing, and I'm very excited that he'll be the governor that actually signs this bill into law.
That's great. One more question. In your ideal world, if we're out of this hand-to-hand combat, if you will, of fighting for rights and fighting for parity, what does your ideal world look like for people who are struggling with mental health and substance use?
Well, my ideal world is that they get the care that they need when they need it, and it's pretty simple, especially with severe and persistent mental illness. If we intervened earlier with schizophrenia, for example, we could permanently change the trajectory of the disability, and we could mitigate the suffering of millions of people nationwide if we did not require them to go in and out, in and out, in and out before they actually get the care that they need. We need to respond right away, first instance of schizophrenia, wrap our arms around them, their family, and intervene, and it would just be a profound difference for those that are suffering from these illnesses, such that they would not have to suffer with the degree of disability that they currently struggle with. In addition to that, we could be doing, as was mentioned, social-emotional learning in schools to prevent many of these illnesses arising in young people who find it difficult to manage their emotions and are bereft of having any skills in problem solving or social-emotional learning that would allow them to better cope with their problems. And that could be addressed. There's so many areas, and also most notably in the social determinant area. Poverty, violence, these are major instigators because these are the most genetic illnesses, most genetically loaded illnesses. And, you know, they're the gun, but the environment is what pulls the trigger. And if we don't address trauma, and we don't address the kind of deprivation that so many people suffer from, lack of housing, we're never going to fully get our arms around this. We can't just medicalize this alone, although we need to make medical care the first and foremost objective. We need to also address these other aspects to ensure people get the well-rounded lives that they need if they're going to function and have healthy lives.
Great. Is there anyone you'd like to thank for effort, or?
No, obviously I'd like to thank Sean Scanlon for his great leadership, and Matt Lesser for his leadership, and my brother Ted for his leadership in helping us get this far. And thanks to all that came out to testify. Thanks to Mental Health America and its Connecticut chapter, and every single volunteer who comes up to try to petition their government for better laws, and who do other things to petition on behalf of those suffering from these illnesses in our education system, particularly important to Paul Gianfrido, our great leader nationally with MHA, and to our criminal justice system, and all the areas where we need advocates. So thank you all who are watching, who are out there doing something to help this movement go forward.
Awesome. Thank you so much.